Happy holidays! I'm Pat Casler, Director of Communications for the Schaumburg Park District. And today we're going to look at a flip side of the holiday situation, and that's that some people aren't always happy. It's not always a gleeful holiday that it's universally expected to be. Today we're going to be talking with Dr. Anna Flynn, a local psychiatrist in private practice in Palatine, and we're going to be talking about holiday depression, seasonal affective disorder, and how it affects both adults and children in our community. Dr. Flynn, welcome to the Go Show. It's so nice to have you with us today.
Thank you.
And we're here in Dr. Flynn's office in Palatine. And Dr. Flynn, during the holidays, people are expected to be so joyful, and there are so many expectations. And when things aren't quite what's expected, a lot of people kind of head into the dumps. How would you characterize that?
Well, what you're talking about, worst case scenario, is what we would call seasonal affective disorder, which describes people who have what we call symptoms of depression. And in the wintertime, what we typically see are people who feel more lethargic, feel more tired. They say they have a hard time concentrating. Mm-hmm. They're sleeping more than they typically do. And they share information saying that they feel a distinct worsening of mood that is different than in other times of the year. Mm-hmm. And so if you have enough symptoms or behaviors that I just described, then we call it depression. And if it occurs in the winter time or typically during the holiday time, then we call it seasonal affective disorder.
Why is there an uptick in either depression or depressive symptoms over the holidays?
That's a complicated question in that there's two ways of looking at it. First of all, the holidays are a time period in which people experience loss or reminder of relationships that perhaps they don't have. Holidays are times of celebrating rituals, and there are expectations that we have going into the holidays and reminders of life events or people that are important to us. And unfortunately, we are in a culture where there's a lot of struggle with that, and financial hardships and various losses. And it can be driven by those factors, mm-hmm. or else it can be driven by the fact that when there is less light during the day, which we experience during the winter time, then you start having problems with sleep, with concentration, low mood, mm-hmm. And it can be a combination of both factors coming together. So I think the important thing is to know that there's a real biological phenomena called seasonal affective disorder, mm-hmm. and that is people who experience a clear, distinct worsening mood during the winter months, mm-hmm. and that happens to coincide with the holidays. Combine that with perhaps some hardship or personal losses, and that in combination can cause the troubles that you described earlier.
What are some of the symptoms of SAD?
What typically distinguishes SAD, although it doesn't always have to exist, mm-hmm. is we see people saying to us that they're sleeping more than they typically do and not feeling rested, that they're putting on weight, that they craving carbohydrates, poor concentration, feeling more lethargic, feeling a loss of energy or drive, mm-hmm. that they otherwise have experienced, and feeling a low mood, mm-hmm. And a down period. That's different than, let's say, some people who come in the spring and summer and say that they feel more irritable, anxious, agitated, restlessness. So those can be some of the distinguishing factors.
What would some of the indications be that one needs to seek treatment?
That's a good question. I think that if you're having any significant and persistent sleep disturbance, mm-hmm. and you start noticing that you're having a harder time getting through your day-to-day activities as a result of that. Let's say there are people in your family or people in your work that start noticing, that you're more irritable, or that you're not as effective in your communication skills and such. I think any time your behavior starts to impact your ability to function as well as you have, I think that's a time period in which you should get an evaluation.
Mm-hmm. And what are treatment options for this type of disorder?
Depending upon how severe the problem is, there is therapy, and there's different types of therapy. When we do an assessment, so to speak, of the person that's coming in, we look at what we call the biological factors, meaning we look at sleep, concentration, energy level. We look at the psychological factors, meaning what is the person experiencing internally, what is their perspective on the world, is there any loss, how are they reacting to and perceiving their environment. We look at the social supports network that the person has, and from there formulate a treatment plan. So sometimes psychotherapy, and there's different types of psychotherapy that can help, can be sufficient. When we see, however, significant sleep disruption, significant concentration difficulties, what we call neurovegetative symptoms of depression, then medication can be helpful, and there's different types of medications that can help. There is light therapy during the winter months. And
I've heard of that.
Yeah.
How does that work?
Well, it involves, typically early in the morning is more effective than in the evening, and you have to have a certain lux, a certain intensity of light, and you get up in the morning, and when you're having your tea or coffee or reading the newspaper, you spend anywhere up to 30 to 60 minutes. 60 minutes is on the long side, but up to maybe 30 minutes with a light box in front of you. And people report that they feel better. Keep in mind, in the winter months, there's shorter days and there's less light. So you're really stimulating the part of the brain that enhances well-being, improved energy, and it correlates with the shift and the decrease in the natural light and day cycle of the winter months.